Hello there, this is Dr. Yasin Tayem, MD, PhD from the University of London. This is the second part of the video on antiviral drugs, which is the problem number 1 in Unit 2. Influenza viruses and anti-influenza drugs. There are 4 types of influenza viruses: A, B, C, and D. Human influenza type A and B cause seasonal flu. Influenza type A is the only one which can cause a pandemic, which is a global epidemic of flu. Neuraminidase inhibitors, such as oseltamivir, zanamivir, and peramivir, have activity against influenza type A and B with almost no resistance, and these are the drugs of choice for influenza nowadays. Mechanism of action of neuraminidase inhibitors like oseltamivir. By inhibiting the viral enzyme neuraminidase, they stop release of the progeny influenza viruses from infected cells and halt the spread of the infection. Anti-influenza drugs should be administered yearly. This decreases the duration of symptoms, duration of viral shedding, and complications. Adverse effects are mild, including nausea, vomiting, headache, fatigue, diarrhea, and rash. Is influenza vaccine effective? All people who are more than 6 months of age should get flu shot once a year. It protects against the most common seasonal influenza viruses. It is administered intramuscularly best in October. The onset of action is 2 weeks. Hepatitis viruses and anti-hepatitis B drugs. Hepatitis B virus and hepatitis C virus are the most common causes of hepatitis that may progress to chronic hepatitis, cirrhosis, and hepatocellular carcinoma. Hepatitis B and C are the only viruses where treatment is available. The goal of chronic hepatitis B virus therapy is suppression of the virus, but the cure is rare. Currently, interferon alpha, entecavir, and tenofovir are the first-line agents in the treatment of hepatitis B. The mechanism of action of interferon is complex. It inhibits viral penetration, transcription, translation, protein processing, maturation, and release of the virus. It also improves host immune function, enhancing macrophages and the proliferation and survival of cytotoxic T cells. Interferon is licensed for the treatment of a chronic hepatitis B virus infection as a first-line drug, and for eradication of a chronic hepatitis C infection, but as a second-line drug. Interferon causes serious side effects. It causes temporary flu-like syndrome, transient hepatic enzyme elevations, CNS toxicity, bone marrow suppression, fatigue, weight loss, rash, cough, myalgia, alopecia, tinnitus, reversible hearing loss, retinopathy, pneumonitis, and cardiotoxicity. In addition, it causes autoimmune phenomena such as thyroiditis. No resistance has been documented against interferon. However, less than 50% of patients respond to it. Its high cost is a problem, and is administered only by injection. In addition, it causes serious adverse effects. Anti-hepatitis B, entecavir. It inhibits viral DNA polymerase. It is used for suppression of hepatitis B virus infection, and resistance is rare. Adverse effects are mild, including headache, fatigue, dizziness, nausea, and upper abdominal pain. Tenofovir. It is an antiretroviral drug, which means that it is used for HIV too, but it has potent activity against hepatitis B virus DNA polymerase. It is used for suppression of hepatitis B virus only if there is resistance against entecavir. No resistance against tenofovir has been shown. Adverse effects: GI tract stress, dizziness, fatigue, and renal failure. hepatitis C virus infection, and anti-hepatitis C virus drugs. Hepatitis C virus is comprised of an envelope of glycoproteins in a lipid bilayer that contains viral core proteins and RNA. Life cycle of hepatitis C. After entry into the host cell, viral RNA is translated into a polyprotein, which is cleaved by both host and viral encoded proteases into mature viral proteins, including non-structural proteins or NS proteins. One of the viral proteases involved in this process is complex of non-structural 3A, non-structural 4A, non-structural 5A. However, non-structural 5B is an RNA polymerase that is used for virus replication. Direct-acting antiviral drugs, DAAs, are inhibitors of non-structural 3A and 4A, or non-structural 5A, or non-structural 5B. The primary goal of treatment in patients with hepatitis C virus infection is viral eradication, which means that a cure is possible in 95% of cases with the use of direct-acting antiviral drugs. Which is better, interferon or DAAs? Compared to interferon, DAAs offer improved efficacy and tolerability, improved dosing schedules, fewer drug-drug interactions, but unfortunately, they are expensive. This slide shows examples on direct-acting antiviral drugs which are used for the eradication of hepatitis C virus infection. The first group is NS3/4 targeting protease inhibitors such as Simiprevir. The second group is NS5A targeting agents such as Ledipasvir. The third group is NS5B targeting polymerase inhibitors such as Sofosbuvir. Several of these drugs are available as fixed-dose combination of 2 or more agents. Ribavirin. Ribavirin is phosphorylated intracellularly by host cell enzymes. Its mechanism of action is unknown, but it may interfere with the synthesis of GTP, viral messenger RNA, and viral RNA-dependent polymerase. Ribavirin is administered by inhalation to children and infants who suffer from bronchiolitis caused by RSV virus, respiratory syncytial virus. It was used previously for hepatitis C, but it has been replaced by direct-acting drugs. The most important adverse effect of ribavirin is hemolytic anemia.